Hello, my name is Edna Ginger Perot, and I'm in my last class for my BSN program at University of Arkansas at Little Rock. The class is Integration of Concepts, and this is my project. Burnout Syndrome in Nurses, Symptoms, Prevention, and Treatment Methods. Certificate of Authorship. By signing the statement, I'm certifying that I'm the author of this work. It was created uniquely for this assignment. I fully disclosed any assistance received for such work and have cited all sources used as support for my work. What is burnout syndrome? It is work-related symptoms manifesting in individuals who experience emotional stress and increasing disillusionment in their work environment. As nurses, we've all experienced this. I don't care if you're hospice, if you're critical care, ED, pediatric, even a clinic nurse. We have experienced emotional distress. The reason that I chose this topic in the first place is because in my local nursing community, 2 nurses that I know have committed suicide in the past 18 months. Now, I'm not saying that nursing caused them to commit suicide, but it contributed to their mental decline. Burnout syndrome is also a state of physical, emotional, and mental exhaustion caused by long-term involvement in situations that are emotionally demanding in the workplace. And this is definitely what we all experience when we work as nurses. For burnout syndromes, there are 3 classic symptoms: exhaustion, depersonalization, and reduced personal accomplishment, or the perception of reduced personal accomplishment. For exhaustion, there's general fatigue, which is understaffing, not having enough resources to take care of our patients, having a heavy workload, rapid patient turnover. I'm normally a night nurse, but sometimes I've taken some day shifts, and I remember one day in particular, I had 3 new admissions in 1 hour, and that is with rotating between staff members. So that was a bit overwhelming. Changes in work schedule can contribute to generalized fatigue as well. If you're normally a night shift person and you take a day shift, that can wreak havoc on your sleep schedule and your mood in general. Another contributing factor to generalized fatigue is how many nursing hours per patient day. Sometimes there are nurses that I know that have worked a 16-hour shift because there weren't enough staff members to replace them at the end of the shift. Also, nurse vacancy rate has a role to play in generalized fatigue because we have to pick up the slack where there aren't anybody scheduled. Emotional exhaustion is another aspect of exhaustion. There's an imbalance in our perception of being able to meet our own high expectations for our nursing practice. If we feel like we're not being effective, if we don't feel like we're doing a good enough job, that can contribute to emotional exhaustion. If we have a lot of end-of-life events, which lately we have some COVID-19 patients, which increases the end-of-life events that we've been experiencing, that can be kind of traumatic, especially if there's no family members around and we're having to be there for the patient in their final moments with no family around. Also, what contributes to emotional exhaustion is lack of control or input in our environment. If we have the perception that we're just told what to do, what to say, and we don't have any kind of autonomy, that can wreak havoc on us. This can also lead to conflicts with coworkers. If we're emotionally exhausted, it inhibits our ability to handle difficult situations or people with different personalities. The third classic symptom for burnout syndrome is reduced personal accomplishment, or the perception of it. We start feeling insufficient, we have poor self-esteem, negative self-evaluation of work, second-guessing ourselves as nurses, and it can lead to clinical depression, which then contributes to mental decline. So the prevalence of burnout syndrome is pretty interesting. In the study that I looked at for my project, family medicine, emergency medicine, general internal medicine, where they have at least one of the 3 classic symptoms, is 40% or greater. Critical care nurses, however, in this study, reported 86% as having at least one of the 3 classic symptoms, but 25 to 33% reported severe burnout symptoms or burnout syndrome, which involves all three classic symptoms. Pediatric medicine is also pretty high at 71%. So how do we identify burnout syndrome? There is a questionnaire that we can take. It's called the Maslow Burnout Inventory. It's a 22-item self-report questionnaire. It consists of 3 independently scored dimensions: the 3 classic symptoms, emotional depersonalization, and lack of personal accomplishment. And it's broken down here as to how many items are under each dimension. Now, this burnout inventory might not be available in all facilities because it does cost money to buy. It's $15 to $50 on the internet, but you can find it. Often, though, we don't really need this questionnaire to know that we're feeling burnout. So the consequences of burnout syndrome. If workers don't feel effective, if they feel numb, if they have lost compassion or empathy for our patients, that can cause negative consequences for our patients. It can cause negative consequences for ourselves. It can cause feelings of frustration, bitterness, and coldness. It can contribute to overall mental decline. Severe cases are at increased risk for self-harm and suicidal ideations. It can also manifest physically. Sometimes people stress eat, like me, which can develop into obesity, which can then cause other illnesses, sleep disorders, and increased risk for cardiovascular disease. One of the nurses I know that I worked as a tech for many years left nursing 3 months ago entirely. She went into insurance just because when she would have anxiety when she would go into the critical care unit, where her heartbeat would just be like 140 to 150, and she just couldn't take it anymore. So through my BSN program, it is my goal to try to help educate nurses how to prevent these symptoms from developing, and to educate everybody with strategies on how we can have healthy coping mechanisms without losing our desire to serve others. So how can we prevent or treat development of burnout syndrome? There's a multi-level approach for increased chance for success. This has to be identified on many levels, not just individually or on a team, but it needs to be recognized unit and facility-wide as well. On a facility level, we need to have a healthy work environment. Help us to expand our authority over our environment through shared governance, through meetings, allowing us to give our input, having supportive leaders that would encourage us to talk and change our environment how we think would be best for us and for our patients. Developing preventive programs help us to have team building exercises. Employee assistance programs. The hospital that I worked at the past 6 years, I didn't even know they had an employee assistance program until last year, but it's been in place for decades. So promoting that knowledge between staff members would be important because it's confidential. No one has to know that these employees called. It's just there, it's free, at no cost, and should be effectively utilized. If you don't want to talk to someone confidentially over the phone, if you don't want to talk to a stranger, there's always the chaplaincy. The chaplaincy has made themselves available to staff members and to leaders as well, to help us with challenges that we face as nurses. There's also a method that we could teach nurses: effective, resilient coping strategies, how to be resilient. I often wondered, going back to this slide, emergency medicine nurses, they only had 40% of one of the 3 classic symptoms, but critical care nurses had all 3. I wonder if because critical care nurses develop relationships with their patients for several days at a time, if that was the difference, or if ER nurses just have more resilient coping skills. It's a good question, but we'll have to analyze that at another time. So the resilient coping strategies that I want to talk about are later on in this program, and it provides a link for all of my peers to look at to help build and practice these resilient coping strategies every workday. can actually be used in your private life as well. So on the unit level, it would be beneficial if we had a realistic workload and staffing. If you're a neuromed-surg nurse and most of your patients are confused or have deficits, can't feed themselves, can't walk, if they're total cares, it's not realistic to have 8 patients to one nurse. That's definitely unsafe. If on the unit level, the leaders were able to give us more control over our problem-solving choices, if we could choose what items we had in the PICSs. We don't need some of these stuff in our PICSs that the critical care needs, and vice versa. If we could choose what's in our environment, if we could have a lift to help us with our patients to prevent back pain, if we could have a bladder scanner without having to search all over the hospital, this would help us reduce our stress level, and it wouldn't contribute to burnout syndrome. It would help prevent that. If we could praise each other and give rewards for individual contributions, say, hey, this was a close call. Thanks for catching that for me. Hey, thanks for helping me with my patient and preventing them from falling or getting to that room faster than I could. And having authentic leadership that encourages us to be open and honest without fear of retribution. Community and quality of social context and work environment means that we value each other and realize that we can't do this without each other. We have to have the team mentality. Going into our next level of team member support. So back on the unit level, when I mentioned team, I think it would be beneficial if we could assign teams. I know the days would be different for work shifts, but we could be team members. We could support each other when one experiences an end-of-life event, especially if we're new nurses and it's our first one. Practicing a pause after the patient expires and just acknowledging what we've all experienced and acknowledging that everyone did the best that they could would be beneficial. Knowing that we can't save everybody, but we did our best is important. It's an important thought process to change from I can't save everybody, but I'm going to do the best I can to save everybody. Team member assistance when one person is overwhelmed with a patient load. Sometimes we don't realize it, but our patient loads can be kind of unequal. One person could be completely oriented, and then halfway through the shift they become confused with a neuro change, and suddenly we can't spend time with all of our other patients because this person is experiencing an adverse change. So having someone help us with our other patients takes a huge amount of stress off of us so that we know that something's not going to get missed. Team member praise when emergent issue is handled appropriately. I am so proud of how quickly you responded to that code. Hey, I'm really glad and proud that you're on my team. You noticed that neuro change in that patient. I'm really proud of you for doing that so quickly, and you got on the phone with the doctor and you got everybody involved. I'm really proud of you, and I'm thankful that we're on the same team. These are things that we can do to encourage each other and uplift them, even when our work environment is really kind of overwhelmingly stressful. Having intentional interaction with team members who identifies at risk for burnout syndrome is also important, because a lot of people may not self-identify as being at risk. They might not realize that their personality is changing, but other people around you that work with you and know you can say, hey, something's going on. Why don't we sit down and talk for a minute? On the individual level, it's important for one to identify their values in work. Those values may start out as I'm going to save everybody, but we can't do it. Well, we have to change our values. We have to change our thought processes. To the best of our ability, we are going to serve our patients. The outcome may be out of my hands if I do everything clinically right. We have to accept that. Focusing on improving one's skill and effective communication is also important. If someone is having a bad day and they're snippy, not responding in a critical or harsh way would be important. And it would also not create divisiveness. It would nurture coming back together later and saying, I'm really sorry. I had a really bad day. Please forgive me. Focusing on organizing a healthy work-life balance is a challenge, and it's something I haven't quite mastered yet, but I'm getting there. Focusing on self-care does not mean coming home and sleeping all the next day. Yes, rest is important, but also intentionally going and doing things that bring joy to your life. That improves your quality of life and promotes self-care. Practicing effective, resilient coping strategies is also important. I mentioned earlier I was going to provide a link to my peers so that they could learn how to develop resilient coping strategies, and that's on this next slide. Bonus slide, how to build resilience. This is very important. It's from the American Psychological Association. This article is less than 10 minutes to read, and if we follow these guidelines on how to effectively change our thought processes, it can help to improve our quality of life and prevent burnout syndrome. I believe this should be a must-read for every nurse going into the workforce. It's that important. They're small things, but small things can build up and really take over our thought processes. If we start small and we work every single day, then we will have resilient coping strategies. So the conclusion that I have for my project is to promote an ideal work-life balance, a person must continually focus on practicing effective communication, practice resilient coping strategies frequently, and focus on self-care. That's at the individual level. To promote a healthy immediate work environment in the unit or with a team, team members must collaborate, support, and help other teammates. To promote a healthy facility-wide work environment, leaders must be supportive, generous with praise, promote fairness, and set realistic workloads. So, above all, care of patient, care of team, and care of self. First question. What are the 3 classic symptoms of burnout syndrome? Select all that apply. Couldn't resist putting in some select all that apply questions in there. Question 2. What percentage of critical care nurses reported having at least one symptom of burnout syndrome in the article that I explained earlier? Question 3. True or false? Patient outcomes may be negatively affected if their primary nurse was experiencing burnout syndrome. Question 4. What are some contributing factors to the development of burnout syndrome? Select all that apply. And question 5. What are some strategies to help prevent and treat burnout syndrome? Select all that apply. Thank you very much for listening to my project. I'm sorry that the camera went wonky halfway through. Thank you very much. Blessings to you all.